So there are also some prone options that you can use constructively versus just sitting. Since we all sit so much, we do have a lot of lumbar compression when we sit. It's not a bad idea for some people, especially flexion intolerant individuals, to start in kind of this extension series that's popularized by the McKinsey approach. There's also a lot of this that comes from yoga, and one of the best places to start is just face down like so with your legs comfortably spread. You can make two fists, or you can put your forehead on the back of your hands in what's called Krokodil Breathing position. And from here you want to focus on just breathing into your abdomen, trying to feel it push into the ground to make your belly rise, to make your lower back rise. And always better if you can breathe through your nose. A few minutes of that, 2 to 5 minutes, can be very, very, very helpful for loosening up that lumbar area and the ribs even. From there, you could go into sort of what's called this like Sphinx position, where you want to get your chest up, kind of push your shoulders down away from your ears, but don't hyperextend your neck. Try to keep it more neutral. If your head has a tendency to poke out, you might want to think about kind of bringing it in a little bit. Mobilize this sort of cranial cervical junction, the suboccipital area, and just hang out here for a few minutes. This could be very, very helpful. If someone's a little more extension intolerant, like myself, like a sprinter type who spends a lot more time in sort of a anterior pelvic tilt or a Vladimir Yanda lower cross syndrome, I do spend time like this also because I do load my spine heavily with deadlifts and squats, but I don't really appreciate, my body doesn't like a lot of extension there because I'm already kind of in it. So for some individuals, they might actually get some nice results from what's called the child's pose in yoga, where you're pretty much trying to go into triple flexion, where you're flexing as much as you can. You can rest your hands on a pillow, or you could rest your hands here. I like the arms out to get a little lat stretch as well and kind of work on shoulder flexion. And going back and forth actually between this and this could actually be almost better than doing one or the other. So you can mix and match. You can use a variety of these different postures to sort of decompress your back, help push discs in if they're a little bit bulged. Of course, you'd want to check with your healthcare provider before doing any of this if you have any questions whether you should be doing any of these activities. I hope that's been helpful.